Welcome to our video on Alpilean and its potential interactions with alcohol, breastfeeding, epilepsy, hypothyroidism, lupus, menopause, PCOS and thyroid medication. Alpilean is a natural supplement made from the root of the plantain herb. It has been used for centuries in traditional medicine to treat a variety of conditions, including fatigue and stress. In recent years, it has become popular as an alternative treatment for anxiety and depression. Alpilean is generally considered safe when taken as directed. However, there are some potential interactions that you should be aware of before taking this supplement. In this video we will discuss these interactions in detail so that you can make an informed decision about whether or not Alpilean is right for you. Alcohol. Alpilean may interact with alcohol in unpredictable ways. While it is generally considered safe to consume alcohol while taking Alpilean, it is important to note that the effects of both substances may be enhanced when taken together. Therefore, if you choose to drink alcohol while taking Alpilean, it is important to do so in moderation and avoid drinking too much at once. Breastfeeding. It is not recommended that women who are breastfeeding take Alpilean due to the lack of research into its safety during lactation. If you are breastfeeding and considering taking Alpilean, it is best to speak with your doctor first before doing so. Epilepsy. There have been reports of seizures occurring after taking Alpilean in people with epilepsy or other seizure disorders. If you have epilepsy or another seizure disorder, it is best to avoid taking this supplement altogether, as the risk of having a seizure may be increased when taken with this supplement. Hypothyroidism. If you have hypothyroidism, it is important to speak with your doctor before taking Alpilean, as this supplement may interfere with your thyroid medication and cause further complications such as weight gain or fatigue. Lupus. People who suffer from lupus should avoid taking Alpilean due to its potential interaction with certain medications used for treating lupus, such as corticosteroids or immunosuppressants, which could increase their risk of side effects if taken together with this supplement. Menopause. Some studies suggest that Alpilean may help reduce symptoms associated with menopause, such as hot flashes and night sweats. However, more research needs to be done before any definitive conclusions can be made about its effectiveness for treating menopausal symptoms. PCOS. There have been some studies suggesting that Alpilean may help reduce symptoms associated with PCOS, such as hirsutism, excessive hair growth. However, more research needs to be done before any definitive conclusions can be made about its effectiveness for treating PCOS symptoms. Specifically, thyroid medication. If you are currently taking thyroid medication, it is important to speak with your doctor before adding any supplements like Alpilean into your daily regimen, as they could potentially interfere with how well your medication works, leading to further complications such as weight gain or fatigue if not monitored properly by a healthcare professional. Conclusion. In conclusion, there are some potential interactions between Alpilean and other substances such as alcohol, breastfeeding, epilepsy, hypothyroidism, lupus, menopause, PCOS and thyroid medication, which should all be discussed thoroughly with a healthcare professional prior to starting supplementation for safety purposes only. With proper guidance from a medical professional, Alpilean can provide many benefits without causing harm, but caution must always be exercised when adding any new supplements into one's daily routine. Thank you for watching. FAQs. Q1. Is Alpilean safe? A1. Generally speaking, yes, but there are some potential interactions which should all be discussed thoroughly with a healthcare professional prior starting Supplementation for safety purposes only. Q2. Can I drink alcohol while taking Alpine? A2. Yes, but it's important not drink too much at once since the effects of both substances may be enhanced when taken together. Q3. Can I take Alpine while breastfeeding? A3. No, due lack of research into its safety during lactation. Women who are breastfeeding should avoid taking Alpine altogether. Q4. Is Alpine effective for treating menopausal symptoms? A4. Some studies suggest that Alpine may help reduce symptoms associated menopause. However, more research needs done before any definitive conclusions can be made about its effectiveness. Specifically, Q5. Does Alpine interfere with thyroid medication? A5. Yes. If currently taking thyroid medication, then speak doctor first. Adding any supplements, like Alpine, into daily regimen since they could potentially interfere how well medication works, leading further complications if not monitored properly by healthcare professional.